all the app features like recorded classes, live class, live exam, exam module is there, practical session is there, MCQs are there, and also with all the app features, we also provide hard copy books. Okay, so this offer is valid till 15th July only, and this offer costs around 13,499. Again, I'm repeating, only 13,499. You are having this combo plan, so please, as early as possible, subscribe to this plan. Um, Other than this limited plan, we also provide some basic standard mentorship plan. Basic plan is of 3 months, standard plan is of 6 months, and mentorship plans of 12 months. In mentorship plan, it costs around 50,000, and also for instant 20% discount, you can use my code, that is Dr. Aanchal 20. Now let's start with today's topic. So first we're going to discuss about sex differentiation. Okay. Maybe you have heard about sex determination, in which we do the karyotyping, and we know about the different sex chromosome, and on the basis of depend upon the sex chromosome, we can easily determine the sex of the infant, right, or the sex of the baby. What we do in the sex differentiation? So basically, sex differentiation take place in two stages. First, we have gonadogenesis, and second stage we have genital duct and external genitalia. So we're going to learn this sex determination in these two stages. Okay, so as we can see in the diagram also, easily we can see that Mullerian ducts are there, right? Then gonads are there and Wolffian ducts are there, right? We can easily see. So from this composition, there will be development of male and female internal reproductive system from this primordial genital gonads. Okay, this is primordial genital gonads. So finally, it will lead to development of male and female gonad. Okay, this side it is showing the development of male, and this side it is showing the development of female. So finally, in the development, we get urinary bladder, urethra. Other structures are also there, like vas deferens, seminal vesicles, prostate gland, then testes, many other structures are also there. Whereas in female, we get urinary bladder, urethra, uterus, vagina, ovary, fallopian tube. Okay, these are structures we get in the female reproductive system. Okay, now we're going to learn that how this sex determination take place, and that we're going to learn under the heading of gonadogenesis and genital ducts and external genital. Okay, so we know primordial germ cell migrates into the urogenital ridge. Okay, so that is the condensation of tissues near the adrenal gland will take place, and where they proliferate to form the primitive gonad. So here there will be formation of primitive gonads take place. Okay, now what happened in genetic males and what happened in females, that we're going to learn one by one. So in the genetic males, testicular differentiation begins as early as 7th week by the Y chromosome. Okay, so there will be testicular differentiation, and this differentiation will be there in the 7th week. Okay, by the Y chromosome with the formation of primitive seminiferous tubules. Okay, in the medulla, and also there will be regression of cortex. Right now, in 8th to 9th week, what will happen? There will be appearance of Leydig cells. And what will happen? There will be proliferation will occur rapidly in the interstitial spaces between the seminiferous tubules until the 14th week. Okay, so testicular differentiation will be there, primitive gonad formation will be there in genetic males. There will be testicular differentiation in the 7th week, then in 8 to 9th week, Glading cells formation will be there. Rapid proliferation will occur between the seminiferous tubule until the 14th week of development. Okay, now what happened in females? Okay, so we know that in females, what chromosomes we have? We have XX chromosome, right? So in the presence of XX chromosome, the gonads continue to show proliferation of the primordial primordial germ cells, which enlarge gradually and become the oogonia. So there will be development of oogonia in the cortex, whereas medulla regression will be there. Okay, then at about 11 to 12 week, oogonia undergo meiosis to form oocyte. So oocyte will be there. That will occur in 11 to 12th week. Okay. And finally, whenever there is formation of oocyte, which marks the point of ovarian differentiation from the undifferentiated gonad. Okay. So this is all about the first stage that we have learned, that is gonadogenesis. Okay, how the formation of gonads takes place. Okay, from primitive gonads, right? Now, next we have genital ducts and external genitalia. Okay, now what happened? At 8th week of gestation period, the embryo has both male and female primordial genital duct. Okay, again I'm repeating, at 8th week means at 2 month embryo has both the male and female primordial genital gonads as paired structures, and the external genital have not yet become differentiation. Means at the time of 8th week, we cannot easily differentiation where the fetus is male or female. Okay. Now what happens? If the primitive gonads become an ovary, or if there are no gonads at all, what will happen? The Mullerian duct from the fallopian tube. Okay. So from Mullerian duct will leads to the formation of fallopian tube, and the Wolffian duct will get disappear. In which case, if the fetus is a female, okay, so Mullerian duct will form the fallopian tube and Wolffian duct will disappear. Okay, and the external genitalia assume their female form during the 3 to 4th month of development. Okay, now what happened if this is the case of female development? Okay, now what happened in male? So in male, Wolffian duct will form the epididymis, vas deferens, and it will form the seminal vesicles. Okay, so this Wolffian duct which get disappear in case of female, it will form epididymis, vas deferens, and seminal vesicles. Okay, this is the male development. Okay, whereas the Mullerian duct will get disappear, or we can say it get degenerated. Okay, so this is all about the sex differentiation which take place during 9-month gestation period, in which we have studied about the 2 stages. First, we have done about the gonadogenesis, and second, we have genital duct and external genitalia development. Fine. Now, next we have the another important topic, that is puberty. Okay, so can anyone here tell me what is puberty? Anyone can define? Okay, now what happened as we have learned about the gonad development, right? So what happened after birth, gonads of both sexes remain silent until they are get activated by gonadotropins, means under the influence of FSH and LH. Okay, and the secretion of FSH and LH come from the pituitary gland, right? So there will be activation of FSH and LH from the pituitary to begin about the final maturation of the reproductive system. Okay, now this period of growth and maturation is known as puberty, or we can determine that this is the period when the endocrine and gametogenic function of the gonads have first developed to the point where reproduction is possible. So this time is known as puberty. Okay, now the age at the time when the puberty is variable. So puberty in males occurs at the age between 9 to 14 years, where in females it occurs 9 to 13 years. Okay, so various changes are there which can be seen in both male and female, like hair growth in females, breast development, acne, mood swings, height, growth, periods. Okay, so these are the signs of puberty in girls. Whereas if you talk about the males, so acne, facial hair is there, voice changes are there, genital growth is there, mood swings are there, and breast growth are there in the case of male. Okay, so these are the various development that take place at the time of puberty. Okay, now if you talk about the control of the onset of puberty. So what is the control? Okay, so before puberty, the hypothalamus is more sensitive to the inhibitory effect of gonadal steroids and keep the releasing of hypothalamic gonadotropin releasing hormone under check. Okay. Now, what happened at the time of puberty? The sensitivity of hypothalamus to this negative feedback of gonadal steroids decreases, and there will be increase in the gonadotropin releasing hormone. Okay, so its secretion will increase suddenly at the time of puberty, right? And there will be more and more release of this hormone from the hypothalamus. Okay, now this will increase, leads to increase in both FSH and LH secretion, and this secretion came from anterior pituitary gland. Right now, the release of gonadotropin releasing hormone is also inhibited by pineal gland hormone that is known as melatonin. Okay. Now, at the time of puberty, there is increase in secretion of adrenal androgen, and this is due to secretion of adrenal androgen stimulating hormone again from the pituitary gland. Okay, so all these things will keep on secreting, keep on increasing, and will lead to the changes in both male and female. Okay, now next we're going to learn about the stages of changes. What stages are there? Okay, so if we talk about the stages of puberty, so in 5 stages we're going to learn. First stage up to 7.5 years. Second stage from 12 for boys and 10.5 for girls. Okay, and also please remember that it can vary in each and every individual. This age can vary. Okay, then third stage, fourth for boys and 11.5 for girls. Then in fourth stage, it is 15.5 for boys and 13 for girls. Then 16.5 for boys and 14 for girls. Okay, so various stages are there. Now we're going to discuss about the changes. So first we're going to learn about the changes in boys, then in girls. Okay. Okay, so up to 7.5, this is the stage of pre-adolescent stage or stage of childhood. Okay, so this is stage of childhood. Here also stage of childhood. Okay, now what happened in second stage means 12 years for boys. So here it will lead to genital development. Okay, genital development will be there by enlargement of testes. Okay, so enlargement of testes will be there, whereas in females it will lead to appearance of breast warts. Okay, then what happened in third stage? In third stage, it will lead to pubic and axillary hair growth and also penis enlargement will be there, right? Whereas in girls, pubic and axillary hair growth will be there and elevation and enlargement of breast is there, and also in this stage there will be gain in height. Okay, then in fourth stage it will lead to further growth of external and internal genitalia, but in this stage it will lead to growth at peak. Okay, means the growth will be very high. Okay, and also increase in height. Then in females, in fourth stage, it will lead to projection of areolus, appearance of menses take place. Finally, in the last stage of puberty, the adult genitalia with secondary sexual characteristics developed. Okay, and what are those secondary sexual characteristics? Like broad shoulders, more muscular body, right? So here, broad shoulder, more muscular body will be there. Appearance of hairs all over the body. Larynx get enlarged. Vocal cord will increase. Then also phalange enlargement will be there. And there will be development of both internal as well as external genitalia. Okay. Then in females, in the last stage, it will lead to adult genitalia with secondary sexual characteristics. Okay, and what are those secondary sexual characteristics? Here also there will be narrowing of shoulder, broad hips, thighs that converge, arm will get diverged, appearance of hairs in axilla and pubic region. Larynx does not get enlarged to that extent as in male, and also the voice become high pitch. Okay, then clitoris increase in height and width, and ovaries, uterus, vaginal growth will be there, right? Acne formation will be there. So various changes are there in both male and as well as in female, right? So this is all about puberty. Now next we have the another important topic, that is menopause. Okay. So I hope already you have learned that what is menopause. In today's class, going to learn about the changes that occurs and about the causes, right? So this is the period in old age when reproductive system undergoes changes due to decreased secretion of sex hormone, estrogen, progesterone. Okay, and this menopause usually occurs at the age between 45 to 55 years. Okay. Now, what is this menopause? If we ask you to define menopause, so you will define it like that menopause is defined as the period when permanent cessation of menstruation will take place, and normally it take place between 45 to 55 years of age. Okay. And in some moments, menstruation stops suddenly, and in some, the menstruation flow decreases gradually during every cycle, and finally it will lead to stoppage, right? And sometimes irregular menstruation occurs with lengthening or shortening of the period with less or more flow. Okay, and early menopause may occur because of surgical removal of ovaries. Okay, if any female is going through removal of ovaries or removal of uterus, okay, as a part of treatment, or abnormal menstruation is there. Okay, now what are the causes for menstruation? So before learning about the causes, let's discuss about the symptoms. So as we can see, symptoms like hot flashes will be there, night sweats or clone flashes will be there, difficult sleeping, emotional changes, mood swings will be there, depression, irritability will be there, vaginal dryness will be there, urinary urgency is there, worsening of permanent syndrome is there, and irregular period are there if the person is going towards the period of menopause. Okay. Now, how menopause affects the body? Okay, so my means what will be the changes that will occur in the body of female when menopause is there? Okay, so the changes like depression, anxiety, dry eyes and mouth, sexual dysfunction, weight gain, dry skin, bone loss, hot flashes, thinning hair, brain fog. So various kind of symptoms are there through which the female will undergo. Okay, if the female is suffering from this time of thing, means if the female is suffering from the time interval of menopause. Okay, so what is causes of menopause? So due to advancement of age, there will be atrophy of ovary. So there will be atrophy of ovaries. Okay, and this atrophy of ovaries will lead to cessation of menstrual cycle, and it will lead to menopause. Okay, so throughout a woman's sexual life, about 450 primordial follicles are there, which get grows into Graafian follicle and finally ovulate. Okay, while thousands of the follicle degenerate at the age of 45, only few primordial follicles remain in the ovary to be stimulated by FSH and LH. Okay. Now, the production of estrogen by ovary decrease. Okay. So, there will be decrease in the production of estrogen. Okay. So, the production of estrogen by ovary will decreases due to decrease in the primordial follicle. Okay. Now, when estrogen secretion become almost zero and FSH and LH are continuously secreted, when all the primordial follicles are atrophied, estrogen secretion stops completely. Okay. Now, what are the changes that occurs during this period? Okay, changes during menopause, or we can also call it as post menopausal syndrome. Okay, so various causes are there. Like for postmenopausal syndrome, the main causes of this symptom is the lack of estrogen. And progesterone. Okay, symptoms may persist till the body get acclimatized to the absence of estrogen and progesterone. Okay, so what are the symptoms for this postmenopausal syndrome? So various symptoms are there, like hot flashes, What is hot flashes? This is characterized by extreme flushing of the skin, and hot flashes start with discomfort in the abdomen, and there will be chill followed by the feeling of heat spreading towards the head. Okay. Then fatigue is there, nervousness is there, insomnia, vertigo, headache, palpitation, urinary disturbance. So these are the main sign and symptoms of post-menopausal syndrome, right? Fine. Now next we have the another important topic, that is non-disjunction. Okay, so we're going to learn about the non-disjunction. So any idea, any student, what is this non-disjunction is? Any idea? No? Okay, we're going to learn. So basically, this non-disjunction is defined as the failure of chromosome or chromatid to segregate during cell division. Okay, so this is the failure of chromosome or chromatids to segregate during cell division. Okay, now what will happen in this condition? So it will lead to daughter cells, formation of daughter cells with abnormal number of chromosome, which is also known as aneuploidy. Okay, as we can see, this is normal chromosomes are forming, then abnormal are forming because there is presence of excess chromosome. Then here also abnormal is forming with excess number of chromosome, absence of chromosome, correct chromosome, right? So either it will lead to increase in the number of chromosome or decrease in the number of chromosomes, right? So usually, what is the cause of this non-disjunction? So it is further characterized into mitotic non-disjunction or meiotic non-disjunction. Okay, so this is of two type: mitotic non-disjunction or meiotic. Okay, so mitotic non-disjunction occurs during the NR phase when sister chromatids fail to get separate. Okay, so occurs during NR phase. Here, sister chromatids fail to separate. Whereas if we talk about the mitotic non-disjunction, so it is of two type. In first type, it occurs due to non-disjunction during meiosis 1. Okay, here homologous chromosome fail to segregate at anaphase 1, and it leads to atoll formation of haploid cells with abnormal number of chromosome. And in second type of non-disjunction occurs during meiosis 2 when sister chromatid fails to segregate, and it leads to formation of half of the haploid cells with abnormal number of chromosome, as we can see, right? So this is all about the non-disjunction. Okay. Now, what are the example of non-disjunction? So some example also we're going to learn, like Down syndrome. So what is Down syndrome? This is the trisomy of autosomes. Okay. means 21 chromosome only. Then one more example is there, like Patau syndrome. In Patau syndrome, again trisomy at 13th chromosome number. Then one more is there, that is Klinefelter syndrome. Here, trisomy of sex chromosome having one excess number of chromosomes, that is XX1. Okay, so these are the various examples of non-disjunction. Fine. Now, next we have pseudo hermaphroditism. So what is this condition? Okay, now what happened in this condition? This is the medical term for a complex group of condition wherein individuals' reproductive organ and external genital do not align with the typical definition of male or female. Okay, so what is this condition? This is the condition where male and female pseudo hermaphrodites are present, are persons or in whom normal gonad development has occurred in accordance with their chromosomal sex, but with data development of heterosexual, means different sex genitalia. Okay, so in this type of person, different sex genitalia is present. Okay, then there are two types of most common person. The first we have female pseudo hermaphrodites and male pseudo hermaphrodites. So in female pseudo hermaphrodite, these are the individual with feminine internal genitalia. Okay, feminine internal genitalia like ovary, oviduct is present, and masculine external genitalia. Okay, like penis is there, testes is there. Okay, the chromosomal sex is female, and the syndrome is there. The syndrome is present due to congenital virilizing adrenal hyperplasia. Okay, so this is female pseudohermaphrodites. Then in male pseudohermaphrodites, a male chromosomal sex individual means genetic, it is male but present with defective testes. And this type of person has female internal and some external genitalia is also present. Okay, and this type of conditions occurs due to deficiency of adrenal and adrenal androgen hormones, right? Now, next we have the last one, that is what is precocious puberty that we're going to learn. So this is the case in which it leads to early onset of puberty, and it refers to at the age of around 18 to 13 in females and 9 to 14 in males. Okay, so this is a condition when children's body begins to change into adult body very soon. Okay, so in this condition, develop into adult very soon. Okay, and most of the time puberty occurs at the age of 8 in girls and after 9 in boys, right? But in this condition, it will lead to puberty very soon. Okay. Now we're going to learn about the symptoms. What are the symptoms that will lead to this kind of precocious puberty? Okay. So symptoms, various symptoms are there, like breast growth and first period in girls, then acne, then rapid growth of body, then pubic and underarm hairs. Okay, so these are the type of symptoms that you will notice in the this case of precocious puberty. Okay, so now we're going to learn that what can be the risk factor and complication. Okay, so if we talk about the risk factor, so being a girl is a risk factor. Okay, means girls are more likely than the boys have to suffer from this condition of early menstruation, early periods, early breast development, and being obese. Okay, carrying extra weight increases the risk of this condition. Okay, now what can be the complication? If the person is having early puberty, what can be the complication? Various complications are there, including short height. Okay, so children with this condition might grow very quickly at first and be taller than the other one, but in further ages, these children often stop growing earlier than usual, and this can cause them to be shorter than and as compared to average adults. Okay, then social and emotional problems will be there. Okay, now what can be the prevention? So no one can avoid some of the risk factors of this condition, such as sex, race, but there are things that can lower the children's chances of being precocious puberty. That is, keep anything that contain estrogen and testosterone away from the children. These might include the prescription medicines or for adults or diet supplements, and always encourage the children to stay at a healthy weight. Okay, so these are the precautions that should be necessary to take for all the children. So this is all for today's class. So thank you so much for watching the class, and also for any kind of doubt and queries, you can connect to us through the various social media platform like YouTube, Instagram, Facebook, Telegram, and also again I'm repeating that this is a limited time offer, and you should all subscribe to this offer as early as possible, because we are giving the feature of all the app plus hard copy books at a very affordable price, that is only at 13,499. Thank you so much.